Okay, but the governor, Deval Patrick, is asking the feds for $450 million to bail out Massachusetts universal health care now. They say they can't meet their expenses unless the feds, and that means people in Idaho are paying for Bay Staters to get health care. Is that wrong?
No, actually, from the very beginning, the plan was a 50-50 deal between the federal government and the state government.
Okay, so the feds fund half of it.
The feds fund half of it. They have from the very beginning. It originally was signed by Tommy Thompson, Republican, then by Mike Leavitt, a Republican.
Is that fair, though?
The deal is that everybody gets the opportunity to get private market-based health insurance, and this is not something funded by the federal government. We're taking money that normally goes to pay for people who get free care. Something most people don't recognize in America is we have universal health care. People go to the hospital and they get treated for free, and we said, look,
in Massachusetts, since the health care has been signed into law, emergency rooms costs have risen 17% in the last 2 years. So the myth, and I think it's a myth, that this emergency thing will go down when you have Obamacare, it's not proven in Massachusetts. Emergency room things are up.
Well, I'll look at the emergency room numbers.
Okay, look, I'm not here to do a gotcha with you, but there's another stat that's fascinating as well. Massachusetts has the highest per capita health care costs in the union, in the nation.
And it did before the bill was passed, too.
But isn't it supposed to bring the costs down?
No. What the bill did was to say, look, we're going to solve a problem at the state level. Two big things that are very different than Obamacare. One is states should be able to solve state problems. The federal government should not step in, as the president has, take away the right of states. We solved our problem on a bipartisan basis. We also had the business community, the healthcare community come together with great support. It continues to have great support.
You say you've solved the problem.
We have our citizens insured, and it's exactly within the budget range that was put in place.
Okay,
so, you know, it's doing what it's supposed to do.
You know me, I'm a simple man, okay? You say you solved the problem in the state, but you're depending on 50% of your funding from the feds.
As we did from the beginning.
Okay, I'm just telling you, I don't know if you solved the problem or the people in Idaho solved it.
But what we did is we took the money the feds used to send to us to give to the hospitals that were giving out free care. The hospitals were doing that before, and we said, look, can we take that money that you give to us that we give to the hospitals, and instead of giving it to hospitals, we're going to use it to help people buy insurance.
One more,
so it was not a new burden on the federal government. It was a redirection of what they've been doing before.
Now, the president says Obamacare is going to bring health costs down. The opposite has happened in Massachusetts. Health costs have gone up, 13,000 plus per capita. So I'm saying if health care costs went up in universal health care in the Bay State, they're going to go up in the United States. Am I sadly misguided?
Health care costs in Massachusetts were high before the bill that got people insured, and they're high afterwards.
They're the highest.
They were the highest before, and they're the highest afterwards.
But it didn't bring them down.
No, it did not bring them down.
Right.
And Obamacare is not going to bring down health care costs.
It's going to make them go up.
Obamacare is going to make health care costs go up. Obamacare does two
why are we doing this?
Well, the president is doing it because he ultimately wants to have the federal government take control of health care.
Okay, but he says they're going to bring health care costs down. You say they're going up.
No one believes that. No one believes that he's actually going to reduce health care costs in America.
Nancy Pelosi believes it?
No, she doesn't believe it. She says it. She says it.
She's a
no
liar.
one believes that the taxes are going to go down. No one believes that the budget is going to get balanced with this health care plan. It's going to be a huge entitlement, which is the federal government taking power away from the states. We solved our problem at the state level. We did it without raising taxes. That's the key.